Hello, my name is Susan Cake, and I am the Director of Policy Analysis for the Alberta Federation of Labor. Today, I'm going to do a short presentation that goes over some of the changes that workers can expect when it comes to Bill 47 and how those changes will impact the workers' compensation system. Okay, so this will examine Bill 47, Ensuring Safety and Cutting Red Tape Act in Alberta, and how this impacts the workers' compensation system. I'm going to start by covering some of the principles that are the foundation for many of the workers' compensation systems across Canada that came out of our court system. And this is known as the Meredith Principles. So the first Meredith principle is that it is a no-fault compensation system. So this means that when a worker is injured on a work site, it does not matter whose fault it is, they will receive compensation and rehabilitation no matter what. And so the idea here is that we don't want to waste time trying to figure out who is accountable for how much of an injury or a disease, that our main goal is to make sure that people are okay, that they receive the health care that they need, that they receive the rehabilitation that they need in order to try to see if they can get back to work in some capacity. So it's a no-fault system. The second is that it's secure benefits. And what this means is that there is a fund, so a pool of money that is available when workers need it. And the idea here is that workers shouldn't have to hope that money will be there for them. They shouldn't have to sue their employers individually and hope that their employers have money to pay them, pay for the benefits and the rehabilitation that they need, so that pot of money is secure and it exists there. The third is that there is collective liability among employers. So what this translates into for the WCB system is that all employers pay premiums into the system, and those premiums cover going to the accident fund and basically provide the coverage for workers if there's injury or disease. And the idea is that all employers have a collective liability in this, and that individual injuries or diseases don't necessarily fall onto individual employers to fund, that it is a collective liability. The fourth is that there's independent administration. So the WCB body itself is separated out from government. It has its own board, which government does appoint to, but it functions independently. Okay, so it's not necessarily part of government. And then it also has exclusive jurisdiction. So this is the idea that WCB should be the only people providing workplace compensation, and it shouldn't be a private market where there's necessarily different vendors that are providing this. If there's one place, they have the sole jurisdiction for it. This has become a bit cloudy and murky as various employees and industries have been exempt from WCB coverage, and also considering farm workers where their employers now have the option of having WCB are going with a private insurance provider. So this one has become a bit murky. But those are the general overview of the Meredith Principles. They're supposed to be the foundation of workers' compensation, and they represent a compromise between employers and workers in that you no longer have a system where you have to sue an employer if a worker is injured, and that employer is no longer at risk of being sued and having the company kind of dissolve because of that lawsuit. And the other thing I want to highlight before getting into the bill changes is actually the history of workers' compensation system reviews in Alberta. So the last large review happened with the 2018 changes, and that review was done over a number of years. But prior to that, the only other review had been in 2001. So it just shows that the WCB Act in Alberta has actually gone decades without ever having a comprehensive review. And considering this is the legislation that also speaks about links from certain workplaces or industries to injuries and diseases, it's mind-blowing that we wouldn't update that as our medical knowledge and our just our knowledge about rehabilitation and injuries becomes more advanced. So it's important that this piece of legislation actually receive regular updates. And the 2018 updates, they were very robust when it came to consultation. So it was headed up by a 3-person review panel. And on that 3-person panel, there was a representative for employers and a representative for workers. So this ensured that, 2 of the key parties in this interaction of employment were actually at the table and able to make recommendations with those representation powers in mind. There was also submissions, questionnaires, and workbooks. I believe there submissions, there was over 200 submissions, many of which are still public on the government website. I think they had over 1,700 questionnaires and over 50 workbook submissions. So there was a broad range of organizations and individuals who actually participated in the review. There was also something called trend talks. So when the panel came across something that they were particularly interested in, a topic that they didn't know a lot about and they wanted to know more, they would actually have a panel put on of experts in the field that are up to date in their knowledge, and they would invite people who were participating in the consultation process to also see this presentation. So it served not just as a consultation, but also as an educational opportunity for everybody. There was also sessions, in-person sessions, which obviously can't take place now because of COVID, but they made sure that there were sessions that targeted specific groups so that they understood the concerns that were actually going on in that group. And this included injured workers. It also, there were sessions that brought together employers and worker reps in the same space at the same tables to kind of talk through some of the issues that they were facing and see if they could come to collective solutions. And lastly, there was progress reports. So it was a very long consultation and there was updates that were coming from the 3-person panel throughout this, just so people were aware of what was going on. Now, if we contrast this to the consultation process that's taken place this time around, and considering that this time we also have substantial changes for the legislation, for WCB, all that took place was a 1-month online submission process for the changes that took place in the middle of the summer during a global health pandemic, and there was no other consultation measures taken. The actual online portal was not publicly advertised. You had to search for it if you wanted to find it, although it was publicly available. The government did nothing to push it to make sure that the public was actually aware that this was taking place, or to even ensure groups like injured workers were having a voice in the process. So a very large contrast to this compared to the last review. Now I'm going to dive into some of the actual changes in the legislation. So the first set of changes I'm going to discuss are regards to compensation. So one of the most substantial changes that we're going to see is the introduction of a new benefit cap. So in the 2018 changes, they got rid of the benefit cap, which recognized actually putting a cap was disproportionately punishing high earners. So the workers, if you were injured and you were a high income earner, the cap basically prevented any coverage from any of the income you had above the cap. So let's say the cap, they've reintroduced the cap now, so it's actually going to be around $98,700. So the cap's around $100,000. That means workers that make over that, even though their employer pays premiums on all of that money over top, they would none of that money is provided if they are injured. So you could see a substantial loss in income for certain workers. And for some families, that may be a sole income earner. So they could see their the income for their whole family cut drastically. And there's really no justifiable reason for this because it just disproportionately punishes certain workers over others if they happen to be injured. The cap also doesn't function by itself. It functions also with a coverage percent. And so previously, and what we're probably going to see is that the coverage percent is set at 90%. So this means that you have the cap, and if you are injured and you require income replacement, they will only cover 90% of the cap, okay, or 90% of the wages. So you never actually see the full amount of the cap going to workers. It's always only 90%. And this so the interaction is something that people are sometimes caught off guard by. They assume if they made under the cap that they would see 100% income replacement, when in fact they do not actually see that. There is also percentage coverage that comes into effect as well. And the third change that I wanted to highlight is the changes to the cost of living increases. So under the 2018 legislation, there was an introduction that if you were on WCB, you would see your benefit from WCB increase by the cost of living in Alberta. So this helps make sure that you can maintain your standard of living, whatever that's set at, and that you're keeping pace with the rest of Alberta. So, as milk and bread and eggs become more expensive, you can still afford them because your income is still going up. So this is incredibly important because workers who are injured and are on a WCB claim do not have the ability to get additional income because they cannot work. So they're exceptionally vulnerable and rely on WCB almost exclusively to make sure that they can survive in our society. The UCP has gone ahead with estimates of how much money, and they are talking about this as how much money it will save employers, when really what it means is how much money are these changes going to cost injured workers? Because these are workers that even WCB is agreeing with that they are injured and they deserve income replacement and rehabilitation. And so the benefit cap introduction, the UCP has estimated that this will cost workers $33 million next year. The cost of living increased changes are estimated to cost workers $240 million in future compensation. And when it comes down to the premiums that are charged in Alberta, Alberta has some of the lowest premiums for WCB compared to other provinces and what they charge employers. Is that this is essentially money that they will probably not, like their premium may be lowered or they may see it come back to them. But for workers who are injured, the amount of money that this is taking out of their pockets from their families and their communities is substantial in some cases, so much so more than the actual savings that individual employers would actually see. So now I'm just going to talk about some of the changes to coverage that came under Bill 47. So the first is the changes to presumptive for psychological injuries. So under our new bill, under the new WCB, only frontline workers will have presumptive coverage for psychological injuries. And this includes paramedics, EMTs, firefighters, dispatch, some of the jail guards. And so then that's kind of it. It doesn't actually, so police officers and peace officers as well. It notably excludes healthcare workers, so nurses, LPNs, healthcare aides, people that still interact on the front lines and that many would consider a frontline worker. So it excludes those people. And so basically the majority of workers will no longer have a presumptive coverage. And so when we say presumptive, it basically means that if you came with a psychological injury to WCB, they would acknowledge that it probably did come from the workplace. But you already had to show two things: that there was a traumatic event or a series of traumatic events in the workplace, and that you have a diagnosis of a psychological injury from a doctor or a psychiatrist or psychologist. And so now, even if you can show that there was a traumatic event or a series of traumatic events and you have that diagnosis from an official, you will still have to, in some cases, fight to get coverage under the WCB. The presumptive part is that if you had those two things, then the WCB would say, okay, we understand it's in everybody's best interest to make sure that you are getting the treatment that you need, and we're not going to force you to prove your case any further. And in every case, an employer could still contest this and say, no, we do not agree. And then a worker and WCB would have to go through the process of proving that this psychological injury should be covered. So now that presumption is taken away. So now when workers are coming to WCB with these psychological injuries, they will have to defend them. And psychological injuries can be particularly difficult to defend. In some cases, the psychological injury is bullying and harassment. And bullying and harassment claims can be incredibly hard to argue, as the people who are bullying and harassing tend not to be very open about it. They tend to try to hide their behavior. So it can be difficult to prove. And then there's also a re-injury process that happens with psychological injuries and having to continually prove it. And then it causes a chilling effect when all other workers see what their coworker goes through trying to get coverage and how devastating it can actually be for them. So there's a lot of issues with this and a lot of reasons why it's a giant step backwards when it comes to WCB. And the UCP has also estimated that this change alone, in just not having presumptive coverage, in forcing workers to prove themselves over and over again for their injuries, will cost workers $230 million over the next 3 years. So this is going to be substantial for those workers. Another component is now employers will not have to provide or continue to provide health and dental coverage for their employees who are on WCB. And so this was highlighted in the 2018 changes because a worker who experiences an injury may also have already had an injury or have a disease that they're dealing with. And the health and dental coverage that they have through their employer could be providing medication or treatment for that. And now a worker may have to take on the cost of that medication and treatment for an injury or disease that is not related to what's covered under WCB. So if somebody has diabetes, they all of a sudden may have to pay for all the medication themselves. If they have a heart condition, they may have to pay for it. And the 2018 changes that required employers to continue this coverage recognized that when workers can no longer afford the health and dental coverage that they had before, it can actually make their work injury worse and prolong their recovery. How do you get better from a broken leg when all of a sudden you're at a higher risk of a heart attack or your diabetes is no longer controlled? So they really thought this was a societal good. And also just the person's family members who are dependent on this coverage as well, it could be devastating for them. And we have to remember that these workers are in a position where they cannot go out and find other employment that may have health and dental coverage, that is not something that they are able to do. And in the cases where their income may be drastically affected, they may not be able to afford private coverage for themselves suddenly. And so it was a really important component. And now this is taken away. And a little bit different, but I'm just going to cover some of the changes to the accident fund because obviously what is in the accident fund affects coverage. And the UCP has directed the WCB board to reconsider their target funding for the accident fund. So this means the pot of money available for worker injuries, how funded is that money? Alberta has often been in the unique position in Canada to have a fund that is overfunded. So it may be, 110% funded, where other provinces sometimes struggle and will have a fund that is 90% funded. However, if we look at the history of Alberta, we know that overfunding is often on the backs of injured workers and denying their claims for as long as possible. And so what the UCP has said, they've asked the board, reconsider your target funding, keeping in mind that businesses are struggling right now and the economy is not the best. These should not be the components when you look at a target for a funding allocation for an accident fund. You should look at the rate of injuries and diseases, the cost of those injuries and diseases, and the rehabilitation that's needed. That should be how you examine how your fund is performing. It should not be that a recession is happening, so injured workers should not have coverage, essentially. And the other component for the accident fund is the UCP has asked the WCB board to re-examine how excess funds are used from the accident fund. So under the previous changes in 2018, and even before then, some of the money that was deemed excess would go towards the intents and purposes that the money was originally designed, which is to help workers get better and to create safer workplaces. So some of the funds would move over to occupational health and safety to help run programs there. Some of the funds go towards research to find out different rehabilitation methods. And some of the funds go to other research that discovers links between injury disease and certain work sites or industries. And so there is never not a need for this money in terms of occupational health and safety and workers' compensation and how we could be doing things better. But the UCP has essentially directed the WCB board to reconsider essentially giving this money back to employers in the form of premium refunds. So now I'm just going to look at some of the changes related to work. One of the biggest wins, you could say, for the 2018 changes was that employers were legally required under the WCB Act to reinstate injured workers once it was safe for them to return to work. That requirement is no longer under the WCB Act. And it's surprising because even the government's own literature on this says that even before this was a requirement, 90% of employers were bringing workers back into their workforce when they were recovered from their injury. So this means there's a very small minority, 10% of employers who refused to rehire the injured workers when they were ready to return to work. And essentially we're creating legislation around that 10%, so around that minority of employers, and we are encouraging their bad behavior. This is very bad for workers, and it is also bad for businesses who are attempting to bring workers back in, especially workers that need accommodation, because it creates an unlevel playing field. So now, instead of going through the WCB process, these injured workers who are not reinstated in their jobs are being asked to go to the human rights process. And the human rights process is lengthy, to say the least. And in 2018, that was recognized as a key issue, that it would take over a year and a half sometimes for these workers to be able to make their way through the human rights system. And while they're in the human rights system, they're not necessarily getting the same supports they would under WCB. So they may not have income replacement because they're not hired because of their injury. They may not have rehabilitation or vocational training to help them find another job. So they're essentially cut off from a lot of benefits. And in the human rights process, there's also no guarantee that the outcome will be that the workers reinstated. There's no guarantee that they're going to get compensation. And so there's a lot of issues with it. And under the government's own reviews and statements as of now, the actual length of time to go through the human rights process is longer than it was in 2018 when the change was first made. And so now you're looking at workers waiting 2 years to even be able to talk to a tribunal about not being reinstated because they've had an injury at workplace. So we've always argued and maintained that WCB should be the first payer, because this is the realm that they work in. They work in workplace injury. Human rights, although it covers discrimination based off of short-term and long-term disabilities, does not work in the same sphere. It's much broader areas. And so that's a significant change for workers, essentially. Next, I'm just going to cover some of the changes around appeals and help that workers had access to. The first one is that the Fair Practice Office is turning into a Fair Practice Officer. So you're going to have the activities that were done by an organization now basically done by one person. And so the Fair Practice Office was available for workers and employers who are trying to navigate the WCB system and running into issues or having trouble. They essentially helped them out with their appeals and make sure that they understood their rights and their obligations and how the system actually worked. And it was important that it was independent from WCB, because there had been a history in our WCB system, especially for workers who had complex claims or injuries or illnesses that had long latency periods. They'd run into more issues. And there was kind of a culture of denial and a culture of mistrust. And so it was important that there was a body that was independent from WCB that could help. That body is now gone. So this new Fair Practice Office commissioner, so this individual person, their mandate is going to be set by the WCB board, and they will essentially be accountable to the board. And some of the activities of helping parties navigate the WCB is being transferred to the Appeals Commission, which is also an internal body within the WCB. And so it might be harder for workers and even employers to be able to trust the system again. The appeals deadline for workers who want to appeal the WCB is gone from 2 years to 1 year. So this just shortens the duration that workers have to understand their rights and be able to appeal decisions. And then similar, mirroring the Fair Practice Office, the Medical Panels Office is also turning into an individual person. And so one of the things that they would do is also do yearly reviews of how medical panels are working in the WCB. And so we might not see anything like that. And one of the other things that I want to cover with the medical panels is that they've also changed and gone away from giving workers the benefit of a doubt. So when you would go to a medical panel, it's essentially when there's a worker injury and you have two opposing opinions from medical authorities. And they would come together in a medical panel to try to work through what the issues were, and why you would have one medical authority saying this and another saying something else. And so one of the things to help people decide when it came to medical panels was if the evidence on both sides was approximately equal, it would always be decided in the benefit of the worker. And that is throughout the entire WC process. And it's really aligned with the foundation of what a workers' compensation non-fault system looks like. And so having that part taken out of medical panels could result in, what do we do if the evidence is approximately equal? We don't have any guidance now in how to make these decisions. And it is inconsistent with the rest of the workers' compensation system to have this change. Now, I'm just going to cover future changes that may impact the WCB. So in the 2018 changes, some of the things that they made sure is that the Act was actually going to be reviewed every 5 years. This is really important, as we saw at the beginning, is that at times, the Act had not been reviewed for over decades, essentially. And there's also a Schedule B in the Act, and this relates to occupational disease and relationships to industries and work and certain occupations. And this section hadn't even been updated in some cases. I think it was since the 1980s. And so there's clearly a history of leaving this legislation and not updating it. And so it was important that we legislate that there will be reviews and how these reviews will be done. That's been changed now. And so now the reviews are once every 10 years. So then again, we're going to go decade before the actual review changes or the act changes. And, this is especially troublesome considering how quickly the world of work is changing. When we have things like Uber pop up and Airbnb, it really changes how people work. And so it's important that all of our employment-based legislation is keeping up with that. And the other important legislative change when it comes to future reviews is that they no longer require a 3-person panel, one of whom represent workers and one of whom represents employers. And so technically a review could be done that is entirely internal to the government, that does not actually talk with workers, it does not talk with employers, or they can even outsource it to a private company just to do that never has to talk to workers or employers either. So it was important that this was in legislation so that any future reviews made sure that they include workers in some way. But we can see from the review that was done here that they were still able to circumvent that in some capacity. So we'll just keep that in mind moving forward. That's essentially some of the changes that were made. So that's the end of the presentation. And once again, it's just an overview of some of the WCB changes under Bill 47. For more information, you can visit the various blogs that we have, as well as the other webinar that focused on occupational health and safety. So thank you so much for your time.